with COVID, things changed a whole lot more quickly than they would have before. Um, the way we handled a COVID patient in March of 2020 was different than how we handled it in June of 2020, um, because we were changing with the evidence that we were learning as we went along. But again, just happened much quicker. So with that said, a lot of the changes that we were running into, in addition to just um, patient care related, a lot of the changes too were the use of new technologies that we might not have utilized before. Um, for example, um, one thing we were doing in the hospital, obviously during the pandemic, we were trying to minimize the amount of people that had to go in and out of the room. We're trying to minimize the contact that we have with, you know, or exposure rather to the virus more than anything. So you would go into a room and you might be in there for 2 hours. And when you need things, instead of what you might usually do is, hey, I'll be right back here, running out of the room, grabbing what you need, coming back in. Um, we were trying to avoid doing some of that. So communication became very important. So uh, they quickly implemented these new sort of phone walkie-talkie type things that you'd click a button, say who you wanted to call, it would call them. You could talk back and forth with the person, and they could, help you out in however, whatever way you needed it. So it kind of helped to one, minimize the exposure, and two, sort of improve some of the inefficiencies you may have run into before.